Good day, everyone! I'm Lucy May Magpantay, 4th year medical clerk from Emilio Aguinaldo College, School of Medicine. And today, I'm going to show you how to perform physical examination on a school-aged child who's having a chief complaint of fever. This will just be quick since it's a focus PE. We will not do everything. And since the patient is school age, so the cooperation span is less, so we need to do this very quick. Hi, good morning. What's your name? How would you like me to call you? Okay, Sarah. I'm Dr. Magpantay, your Pedia doctor for today, and I'm going to assess you. Would that be okay with you? So just tell me if you feel uncomfortable, or if I touch you, there's anything that you felt painful. Let me know, okay? Now, let's start with the vital signs. Next is anthropometric measurement. Get the height and weight and then compute for the BMI. Plot it on the WHO Z-score. And also don't forget to compute for the ideal body weight. Next is general survey. So my patient is awake, ambulatory, not in cardiorespiratory distress, but weak looking. Now we go to head-to-toe assessment. Since the patient's chief complaint is fever, we all know that fever is a non-specific sign of infection. So we need to investigate or know where is the infection coming from and what system is affected. Before I start my focus PE, since the chief complaint is fever, I have a lot of differential diagnosis in mind. So it could be measles, dengue, malaria, a simple cough and colds, or since we have the ongoing pandemic, we cannot totally rule out the possibility of COVID, especially there is fever, no? And it could also be a neurological cause, meningitis, for example. For the skin, inspect for the presence of any maculopapular rash. In my patient's case, she has a maculopapular rash on her trunk and as well in her extremities. For the eyes, inspect for any redness or pus. If there's pus, it's a complication of measles already. In my patient's case, she has
an icteric sclerae
with no pus. And then since we are also thinking about a neurological cause, so we also need to check for the pupils reaction. So the result is pupils equally round, reactive to light and accommodation, so there's no problem. Next, for the nose, we need to inspect if there's any nasal discharge. So that's a sign of a cold. In my patient's case, the nostrils are clear and without any discharges. For the mouth, check for any presence of Koplik spots, as well as for the size of the tonsils, and see if the tonsil is inflamed. In my patient's case, I saw a white Koplik spot on the right buccal area. For the lungs, listen for any adventitious sounds. Using the bell of the stethoscope. Okay, Sarah, can you please deep breathe? In my patient's case, she has a clear breath sounds. Since one of my differential diagnoses is dengue, I would like to know if there is any associated or presence of abdominal pain. Sarah, I'm going to palpate your abdomen, so just let me know if there's pain that you felt, okay? Since I'm also considering meningitis as the cause of the fever, it is important to do neurological exams such as Brudzinski sign and the Koenig sign. In Brudzinski sign, once we flex the patient's head, the hip and knee will automatically flex. So that's a positive Brudzinski sign. In Koenig sign, once we flex the hip and the knee to 90 degrees and then we try to extend it more than the 90 degrees, it will cause pain and there will be limitation on extension. As a summary, so for the temperature, my patient is having 38.8 degrees Celsius, and then for the focus PE, for the skin, I saw maculopapular rash on the trunk and on the upper and lower extremities, as well as in the mouth, I saw a Koplik spot on the right buccal area. So now, I'm considering my patient having measles. That would be my working impression. That would be all. Thank you.